Okay, great. This is Jose Avila. I'd like to call the meeting of the Board of Health to order. It is approximately 4 p.m. on Thursday, September 3rd, 2020. And I'd like to do the roll call. Again, my name is Jose Avila.
Rick Bearable.
Steve Krakowski.
Dale Pittman.
Darcy Du Bois.
And Gary's in the background. Gary, can you please let us know you're here, please?
Oh, yeah, Gary Hintz.
Thank you.
I'm not sure what order on the table we're on, so.
Oh, okay. And we do have a quorum. So I'd like all of you to, if you haven't had a chance to look at the minutes from the last meeting, to please scan them briefly. And then when you're ready, I'd like to entertain a motion to accept the minutes, for approval of the minutes, excuse me.
They're relatively short.
Mm-hmm.
Yep, not
I'll
much.
move to approve.
Okay, Rick removes. Anybody second?
I'll second it, Gary.
Gary? Okay, any other discussion? No? If no other discussion, all in favor say aye.
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 Opposed?
Well, Krakowski abstains.
Okay, abstention. Thank you. Excuse me. Health Department update is the next agenda item. Ms. Darcy.
Okay. So you have a brief report and some data, and then I will also share some COVID updates and data through sharing my screen. So I'll give you just a minute to look at that, or maybe you don't need it. Actually, I sent it out. So just some highlights from the written report. We do have 2 current vacancies amongst our regular staff. So we are currently in the hiring process for our health clerk, who sits at our front desk, as well as our part-time public health nurse. So both jobs have been posted, and we hope to do interviews in the next couple of weeks for those positions.
Right.
We're currently waiting to hear from the state about ongoing grant funds. So we have grant funds and have hired some additional staff, which I'll talk more about in a minute, for COVID response through the end of the year. The state has assured us there will be some ongoing grant funding, and we're waiting for those details to kind of make a longer term staffing plan. The beach monitoring has continued, but will end as of this weekend. That's the final testing sample, and then the beach will not be monitored. The water quality will not be monitored after that anymore. And we are starting to work on a plan to reintroduce additional health department services. So we have largely remained closed to the public because everyone has been doing COVID response, but are planning to do flu vaccines and reintroduce some of our other health department services. So hoping to do that in the next couple of weeks as well. As far as data, there's not much to highlight, except for just obviously you can tell through the number of communicable disease investigations that we're spending, vast majority of our time on COVID-19 at this point still. Wanted to share some COVID updates as well. So as of today, we've had 717 Oak Creek residents who have tested positive for COVID. We've had 6,731 Oak Creek residents who've tested negative for COVID. 664 of those 717 who've tested positive have been recovered and released from isolation. We've had 19 individuals pass away as a result of COVID. And so we do have about 34 individuals who we consider active cases who are still completing their isolation period for COVID. I'm going to go ahead and share my screen. Okay, can you see
Darcy,
a graph?
can I ask you just a real quick one?
Yep.
Can you just review what are the recommendations again for, if obviously not if you've been infected, but if you've been exposed to someone, what are they? Because I know they've changed a little bit.
For quarantine?
Right.
Yep, so the quarantine period hasn't changed for quite a while. It remains 14 days. So we do ask close contacts to quarantine for a period of 14 days after their last exposure to a person who has COVID-19.
And then they should only get tested if they're symptomatic?
The current recommendation here in Wisconsin is that anyone with symptoms and those who have been identified as close contacts consider being tested. So at this point, we do not have a testing shortage in Wisconsin, so the testing recommendations have not changed. We have seen in other parts of the country where they are experiencing testing shortages with materials or lab availability that they have changed some of those recommendations, but we are still encouraging anyone with symptoms and asking anyone who's a close contact to consider being tested.
Right. And the reason I was asking was because of that about a week or so ago, the CDC slightly changed its recommendation, but
Right.
I'm glad we're still doing that. And thank you so much. And I will be quiet now.
No need. I'm happy to answer questions. So can you see a graph on the screen there?
Yeah.
Okay, so this is showing the number of new weekly positive tests going back through March. So you can see that, you know, throughout the month of July and the first half of August, we were seeing fairly high numbers. The last couple of weeks, we have seen a decrease in the number of new individuals testing positive, which is encouraging. The graph shows the total number of individuals who are tested on a weekly basis. Similarly, you can see that we were seeing higher testing numbers throughout July and early August, and the number of weekly tests has been decreasing over the past couple of weeks as well. It's hard to know if that's because people are experiencing less symptoms or if there's kind of a fatigue with getting tested or if people are enjoying the rest of their summer and trying not to think about COVID. So, you know, we obviously are paying close attention to the data and, you know, we'll be interested to see what happens over the next couple of weeks and months as many families are resuming with school and sports and things like that. This graph here is a heat map. It shows the last two weeks. So the first one goes from August 19th through the 25th. The second one on the right goes from the 26th through September 1st. So this is showing the new COVID tests across the county. The red areas have the higher incidence rate, the higher number of new COVID tests per their population. So you can see that, well, earlier when we were looking at these maps in July, the majority of Oak Creek was bright red. We have transitioned more into the orange and yellow as we've seen lower numbers of COVID cases and are not one of the communities that are seeing the highest number of new cases at this point, which is also really good news. And this is a chart of the what we call the burden. So this is looking at the number of new positive COVID cases over the past 14-day period. And it's normalized per 100,000 residents, which allows us to compare our COVID burden rate to other communities and kind of compare and contrast. So similarly to other graphs, you can see that as we were going through July and early August, our burden number was very high, up into the 400s. We've now dropped down to 128, which is also very encouraging and in line with the other kind of testing data that I shared earlier. We do continue to share data updates with the community 3 times a week on social media and the website, as well as updating the COVID-19 Oak Creek dashboard that I believe I shared at the last meeting that shows more of those demographic and testing data as well. I mentioned our staffing earlier, so we have hired 8 additional part-time staff that are funded with the COVID-19 grant funding we received. 6 of those staff have started and are up and running with doing contact tracing. 2 additional staff will start in the next couple of weeks. And we are hopeful that with those 8 staff, even if we see another spike in cases, that the workload will be a little bit more manageable and that we won't have our regular staff working 7 days a week as we've all done many weeks since this started. We will also be working with a UWM School of Public Health epidemiology student, a master's level student who's going to help us with some additional data analysis and review. We do get lots of questions about the data, and certainly the data helps us to understand the situation, but we all have had limited time to kind of dive into that and spend a lot of time looking at some of those questions. So I'm looking forward to having someone with more dedicated time to take a look at the impact of COVID here in Oak Creek. As I said, we're still waiting on grant funds. We do expect to be able to keep at least some of our extra staff on for a limited term basis as we move into 2021. We don't expect, unfortunately, that COVID will go away at the end of this year. And we know that as we start thinking about preparing to hopefully administer a COVID-19 vaccine once it becomes available, that we'll need to both continue doing our contact tracing work and start opening up vaccine clinics to the community. So we're starting to think about how all of those pieces will fit together once that vaccine becomes available. A couple of other updates regarding the masks. We have seen some largely compliance with the mask order that was issued by the governor about a month ago. We are receiving mask complaints. People can call in, or there's a form on the website they can submit those. And we are following up on each of them. We're focusing largely on education, making sure that especially businesses or gathering places are aware of the mask order and of the responsibility to make sure that individuals there are wearing masks. And largely though, that follow-up has gone very well and the public has been very responsive. Just a couple of final points. So we are really still encouraging all of those risk reduction measures that we've all heard so much about since March: the physical distancing, the hand washing and cough sneeze etiquette, wearing masks, and encouraging people to, think about the gatherings and events they're attending. The safest thing to do is still to spend time primarily with people from your household, and that is the guidance that we are giving. We know we have the holiday coming up with Labor Day. Last time following the 4th of July was when we saw that very large spike in cases. So we are really hoping that we won't see something like that following Labor Day, but also at the same time, kind of being prepared in case that does happen.
I kind of noticed that on all the graphs you had, it seemed like as more testing became available, that's when the graph went up to see, more people tested positive. You think that maybe that hasn't really changed that much? Is just the testing is showing it?
So one thing that we do look at as well, and actually I don't think I mentioned, was we look at the percentage of positive tests. So, when we're seeing individuals get tested more, we did see more positive results, but we also saw that percentage of positive tests go up, indicating that, even though more people are getting tested, there's still a large number of them that were testing positive and that there is more disease in the community. And that is one main reason we look at that percent positive. We want to make sure that enough people are getting tested so that we have a good idea, a good understanding of the amount of disease, and so that we are able to isolate and quarantine those who have been impacted. So we have seen that percent positive drop down significantly over the past couple of weeks as well, which I think is a good sign. I do think that there's less disease in the community now than there was a month or 6 weeks ago. Could be for a variety of reasons, like I said, but we are still encouraging individuals to get tested if they're symptomatic. Any other questions?
Darcy, this is Jose again. I remember that you did the testing over in Cudahy. Is there any plan to do that for just a brief period of time again, or do they still recommend going to the parking lot of UMOS and the north side by the high school?
So at this point, we are doing a lot of planning for testing. When we stood up that site in Cudahy, it was in partnership with the National Guard.
Right.
They have decreased the number of National Guard teams that are available to do testing, and so that they're not quite as available to communities. But we also know that while they are currently staffing those 2 testing sites that you mentioned on the south and north side of Milwaukee, we've been informed that those testing sites will most likely close the first week in October, and that the National Guard is not going to be available for that. So we're looking into various options. Each local health department did receive a grant funding allocation to help coordinate testing in the community. Ideally, we're hoping that each of us doesn't need to hire staff to do that. We're looking at some collaborations with the other suburban health departments in our region to maybe jointly hire some staff and have them rotate between communities to make testing available, or maybe collaborating to continue with a site like has been at UMOS or Custer Stadium at a different location. But it is a concern that if testing becomes less accessible, that fewer people will get tested, and then we won't be able to identify and isolate and quarantine those who are impacted. So that's something we're spending a lot of time on right now.
Great, thank you so much.
Hey, Darcy?
Yep.
Do you want to touch on what was discussed at the council meeting Tuesday night, or do you want me to summarize that?
Whatever you prefer.
Okay. I'll tell you what, I'll start, and if I miss something, you chime in at the end.
Sounds good.
Yeah, for the information of everybody, we had a discussion on Tuesday night. Primarily Kristen from the Tourism Commission was the primary person speaking, but Darcy was there just in case something needed to be said. And we talked about how the city did the summer and moving into fall winter events, because we had given the city administrator, us, the council, said, don't shut down summer. And so we kept everything open, and tourism did a pretty good job of trying to remind people how to attend the farmers markets and the beer gardens, because as an alderman, I was getting some complaints from constituents they were just comments that they weren't thinking through. Was, well, we're doing beer gardens, we're doing farmers markets, but we don't have the splash pad open. But that's water over the dam or under the bridge, however you want to do it, because when it was being discussed to reopen the splash pad, it was the spikes in the COVID-19 rate. So that kind of took a backseat. But so looks like we're moving forward with keeping stuff open in the fall and the winter. There with some changes, like for example, the arts and craft part of the Christmas tree lighting and hot chocolate and stuff like that. That's not going to happen because it's just an inside event that really, I don't think anybody really knows how they're going to be managed just yet. Time will tell if those are problems. But the Christmas tree lighting will be done, and a few other events will be out there, and try and get some signage out there to remind people about social distancing and wearing masks and stuff like that. So I did compliment the city as a whole for keeping summer open. And I do want to point out that, as I did at the meeting, Aben Skate Park, I think, was open all summer long, right, Darcy? That was never shut down? Or
not
initially it may have
early
been.
on, right?
Yeah. But that opened up, and then much to my delight personally, Abenshine Park, baseball park, opened up, and there were a number of baseball teams, both adult and youth, that utilize Milwaukee County baseball fields. And of course, Milwaukee County didn't do anything with their fields this summer. So they migrated over to Oak Creek and they utilized Abenshine Park. And it would be interesting to see the statistics because I think it was busy like every night. Every night I would go by, there was teams playing baseball there. And I umpired some games there. And, for the most part, everybody tried to do their best with social distancing and stuff like that. So I think it was a very successful year. And I just wanted to share that with you. We didn't leave that discussion with any questions other than to move forward and keep fall and winter open. And indoor events are going to be, I think, problematic because you just don't know. We're kind of at that, Darcy, I kind of think we're at that stage where, all right, we survived summer because everything was outdoors.
Yeah.
But now we're moving indoors, and you don't know what basketball is going to bring, school's going to bring, football games. It's just it's a whole nother chapter. So if anybody has any questions, or if Darcy has anything to add, I'm done talking.
No, I think, I have been meeting with Kristen, the tourism person, on a regular basis and giving some feedback and ideas about things to consider to make, events safer. I don't think that we can say that gathering at any point is ever safe, but there are certainly things, like you alluded to, Alderman Kurkowski, that can be measures that can be put into place to help make them safer. Certainly being outdoors is definitely safer. I think we're going to learn a lot in the next couple of months, like you said, as the weather gets colder and we see people start to come together, in school settings and in more indoor sports settings. And, we'll learn a lot about what those things bring. We haven't had a chance to see that yet. So, and we'll certainly see the recommendations likely change, and the you know, as we look at data and see the impact, if it's not as bad as we, you know, fear it could be, well, the recommendations will change. If it's worse, the recommendations will change. So, you know, I expect this will continue to be an ever-changing situation, which I know is frustrating to some people when things change, but I think it's important to note that we are continually looking at the data and the evidence and trying to make the best recommendations based on the experience that we've had with this new coronavirus disease. So
I just want to point out that I've done umpired over 100 games this summer, and you would think that, you know, some guys that I know around the country have done like 10, some have done none. And, you know, I did a couple of 62 and over games at the Rock, and that is the age group where should be most concerned. And, you know, those guys were just playing ball just like they always have, high five, shaking hands and stuff. And you kind of cringe a little bit because, hey, folks, you know, we're trying to be careful here. And then you go to the other end of the spectrum where you've got 13 and 14-year-olds where they are social distancing in the dugout. They're kind of spread out a little bit. And you say, well, don't share equipment. Well, the coach comes out to warm up the pitcher, and then he hands off the glove to the catcher coming in. It's like, oh, gee, they're sharing equipment. But you know, there weren't any problems. And you know, bottom line is, you can mandate all you want, but folks aren't. You know, some of them aren't going to wear masks if they don't want to. And you know, and high school kids, you know, they're going to go to school wearing a mask, but what are they going to do when they get out of the building? They're still going to take off their masks. They're still going to socialize with one another. And, you know, I saw it all at the Rock. I see it all over the place at the farmer's market and stuff. And you just hope for the best. That's all you can do. So, okay, I'm done again. Any questions?
No.
Wow.
Darcy, I did have one question for you. Are you still routinely meeting with the other health departments in the area, like either by Zoom or phone, to plan for the future?
yep, we have Zoom meetings 4 times a week with the other health officers, well, 3 times a week with the Milwaukee County group, and then once a week with kind of the Southeast region. So bringing in some of those surrounding counties that are neighboring. And then we do have a daily call with the state health department as well with the health officers. So still lots of connection there, lots of collaboration and working together.
Oh, good. That's good to hear, though. That's good. If there's nothing else, Darcy, anything else from your perspective health department update?
Nope, I think that was the information I had today.
Great.
Darcy, do you, how does the fever whole thing work into this? At what point do you see people start getting a fever? I mean, people are checking for fevers. We do it in the store here. We've got a scanner. We actually both.
Okay.
And, we've had 4 people that have had a fever, not real high, and those people were like, it was when it was 90 outside, and they were outside, like landscaping people. In fact, we manufactured a scanner system, and we're working with that company in Oak Creek that's in the old police station. And we let the Lions use it and the Dream Drawing thing use it. And I mean, we seen, you know, nobody had fevers really of all the people that were checked. So I wondered, does the fever thing really even?
Yeah, I think it's a good question. Initially, I think you know, when we were very early in the pandemic, it seemed that was, you know, a primary symptom and that most people had a fever. You know, at this point, I would say that we're probably maybe seeing, you know, I don't have the actual number, so don't quote me, but maybe half of the people report having a fever or feeling feverish at some point during their illness. So I don't think that definitely not everyone that has COVID is experiencing a fever. We also know that, you know, a fairly large number, I don't have exactly that number, but, you know, a decent number of people who test positive are asymptomatic. And while they can still spread disease, they report not having any symptoms, a fever or anything else. So, and we've also, since early in the pandemic, really seen that list of symptoms expand. So I think early on it was, you know, fever, cough, shortness of breath, kind of those really strong respiratory symptoms.
And
but
then
now
losing your smell too.
What's that?
Losing your smell and taste.
Yep. So we've seen different kind of weird symptoms pop up, like a lot of people report losing or a change to their sense of taste or smell. We've seen a lot of nausea, vomiting, diarrhea, abdominal cramping, muscle aches, fatigue. With older adults, a lot of times we see a report of kind of some cognitive symptoms, some confusion, or feeling dizzy, things like that. So I think we still have a lot to learn, probably. And Dr. D'Amico, if you have certainly can speak to the experience you've had if you've been seeing patients with that. But I think there's not a super predictable way that the symptoms manifest at this point. It's really quite varied.
Yeah, I guess I could comment. I agree with everything you said. The fever tends to be one of the top 3 symptoms in people that are significantly ill, is what we're seeing at this point. But you're right, a large percentage of people are minimally or mildly symptomatic or asymptomatic is what we're learning. So yeah, the temperature screening has somewhat limited utility, I guess, is probably why you're asking. But, it's,
Right.
I guess at the same time, the best thing we can do at this point.
Because I see even the dentist office here, they have to go out and take everybody's temperature before they come in, and I'm just wondering,
Yeah.
it really make any sense,
Yeah, definitely wouldn't catch everyone who could potentially be sick, I would say.
No, and, as part of the temperature screening for our office, everybody that comes in the building, not only do they get the temperature screening, but they get the whole litany of questions.
Yeah, we do that too at our.
Symptom-wise and potential contacts and pending COVID tests and all that. So it's a little more extensive screening if you go beyond just checking the temperature, but we don't expect that in facilities or places that are not medical in nature. So
I mean, I guess this all depends on, it all kind of goes back to common sense. If you don't feel good, stay home, right?
right.
This is just an off the cuff question, but now that we're going to get into flu season, how are we going to deal with that? Because people are going to come in with fevers. People are going to come in with body aches and chills, and that's going to be a hard one. It's going to be a real hard one.
It is. I think we're hoping that we'll see the COVID test incorporated with kind of the panel of respiratory tests that are routinely done when someone comes into the clinic. So, if someone comes in with those symptoms, they might do a panel for influenza and, some other illnesses. And, if COVID tests could be incorporated into that, I think that's a healthcare system decision. But certainly, I think we'll see a big push for people to get the flu vaccine this year. We want to, as much as possible, limit the number of people getting sick with flu, not only because we want them to be healthy and have their immune systems as strong as possible, but we also want to limit the number of hospitalizations due to flu in case we see a large spike in COVID cases and we need those hospital beds for those patients. So I think that's an important question and something that we are definitely concerned about how we'll see the interaction of those two things this fall.
Is Freighter going to keep their COVID testing back in their parking lot long-term or just?
Yeah, I haven't heard that they plan to stop, and they did a month or so ago make some changes to make it more of a kind of a semi-permanent site with a trailer and things. And I know part of that was thinking about the upcoming colder weather and kind of the safety and comfort of their staff. So I'm hopeful that they will keep that going long-term.
I had to have a test and they told me it would take 2 days, but I had my results in 10 hours.
Oh, wow. That's great.
Yep. Mm-hmm.
Well, great. Well, thanks, everybody. I guess if there's no questions, let's go on to the environmental health update.
All right. I know Darcy had mentioned about the mask complaints. I was the one that was following up on that. For the most part, it was pretty, the businesses were pretty receptive of, what the requirement is. And for the most part, they knew what it was, but sometimes, people would slip in and get by them and they didn't realize it. Other than that, had a couple businesses that were pretty not for masks, let's put it that way, and they weren't going to enforce anything really. But then I just let them know whenever I got a complaint. So, and the next thing was about renewals. License renewals typically on a yearly basis is due by June 30th. So this year we extended it to September 30th. So by the end of this month. But as of now, I got about 14 out that are out yet. So I'm expecting almost all of them to renew by the end of this month. I think the Classic Lanes bowling alley is kind of on the fence. When I talked to him, he was on the fence of whether or not he's going to be able to keep his business open. But I'm kind of fully expecting all the other ones to renew by the end of this month. So hopefully that'll happen. So in talking about fees there too, DATCAP has updated their ATCP 75 in regards to licensing categories. So that's all going to go into effect for next year. So I'm kind of in the process of reviewing all that, but the fees shouldn't change too much at all from moving from the structure we have now to what it's going to be. So I'm kind of making it somewhat a parallel move. And we may have to increase fees just a touch on some items, but we'll see. We'll see once the transfer gets in place. So, but otherwise, that's about all I have right now.
I just had a question. Do you know, is there something going in on the corner of 13th and Drexel where the old Freighter Hospital thing was supposed to go?
Actually, I just found out today, what is it called? Milwaukee Yard, I believe. The way it sounds, it's going to be like an indoor, I think, soccer and some fields or indoor recreational type things, maybe, and also some retail stores, possibly. That's kind of the little that I've learned just this morning, actually. So.
There's going to be Summit Credit Union.
Okay.
The micro hospital is off the table.
Right.
There's one lot there that was destined to be a food establishment, but nothing is set for that. And yeah, you got Milwaukee Yard, which will offer indoor soccer, and they'll have some daycare and a few other amenities there. It's based on a company that has a similar operation in Illinois. And then just north of that, obviously, is a Wingspan apartment development. There was a few other things planned, but it's kind of on hold. A lot of it was due to COVID.
Right. Great. Anything, Dale, anything else?
Just one other thing I want to, as far as mass complaints, I've got 33 at this point since August 1st. So roughly one per calendar day average. So, and actually it's kind of slowed up now. So.
I presume most of those are not related to health conditions precluding mask use.
Yeah, we don't know. We don't know if that's the case, but yeah, I'll leave it at that.
The complaints are generally focused on a place or a business. So, X business or X event place, is not requiring people to wear masks. And so then, we follow up with that business and make sure they're aware of the order and answer questions and things like that.
That makes sense.
Yeah. That actually brings up a good question. If somebody has an exemption for not wearing a mask, how do they prove it?
There's no need
It's
to
not
prove
necessary.
it. Yeah.
Not necessary. Okay.
I know of one individual who carries a copy of a doctor's like permission slip or something with her. When she got accosted for not wearing a mask, she whipped it out and said, "Here you go." So.
Okay.
But isn't it correct that an establishment is not allowed to ask because it's a HIPAA issue? I mean, or that's what I was told. You know, you can't ask a person why they're not wearing one. Is that
So-
true or false? Is that an
Uh,
urban legend?
Yeah, it's an urban legend. Only healthcare providers are required to comply with HIPAA laws. So,
Right.
you know, I don't know if businesses are asking people why not, but you know, certainly they can remind people that they should be wearing masks in their establishment, and you know.
They
And they
may
have a right-
also have the ability to refuse service and
Yeah.
Mhm.
Right.
Right.
Great.
Protest all you want. There's the door, folks.
Yeah. Okay, we'll move on to old business. Any old business?
Don't believe so.
No. Any new business? Anybody new business? And thank you, Michael D'Amico and Denise for joining us.
Sorry about it was late.
Oh, no, that's fine. Thank you, though. All right, so if anything else that we need to discuss, other than that, if there's nothing else to discuss, our next meeting is scheduled for Thursday, November 5th at 4 p.m. And I'm presuming it's via Zoom at this point.
Correct.
And anything else anyone wishes to bring up other than thank you, Darcy, for all you guys are doing again. And much appreciated. And if not, I'll entertain a motion to adjourn the meeting.
I make a motion to adjourn.
Thank you, Denise. Second.
Gary seconds it.
Gary seconds. Okay. Any further discussion? Otherwise, all in favor?
Aye.
All right.
Aye.
Hi.
Opposed? Abstentions? Super. Thanks, everybody.
Bye.
Um,
Thank you.
Yep. Take
Okay.
care. Have a
Aye.
nice Labor Day, everybody.
You too. Stay safe.
You too.
Bye.
Thank you. Bye-bye.